One of the simple things I had to learn after my hip replacement surgery was how to get a compression stocking on my affected leg. And if you're like me, you may not be able to reach your foot or your toe. You can't actually get down that far. Um, my doctor prescribed a compression stocking, and I didn't know how to actually get the thing on. So it's usually the purview, I think, of an occupational therapist. But in my case, I went to YouTube and discovered there's a device that looks like this. It's a stocking donor. You can get them on Amazon. You can get them at a medical supply store. And then to get the stocking off, you get a stocking doffer, which looks like a shoehorn with a handle on it. And then the stockings, started out with a firm pair, which was 20 to 30 mmHg, and then I eventually graduated to a 30 to 40 mmHg. I don't know what that stands for, but it's extra firm. So I'm not really endorsing a brand, but this is what I am currently wearing at week 10, and it's actually helping with the swelling quite a bit. So the first task is to load the stock onto the stocking donor, and you place the heel toward the back of the frame device and the front of the sock toward the open part. And you just simply start by placing it over the frame and pulling it down until you see the heel pop up, and it is indeed toward the back of the stocking donor. And you keep pulling it down. Eventually you will get to see the toe. And in my case, I don't take the stocking or pull it down all the way to the toe. I just leave a little bit of a place to place my foot. Once you have the stocking loaded on the stocking donor, you can just actually place it on the ground like that, and take your foot and place it in the front part until you can feel your toe reach the end of the sock or the toe of the sock. And then just rock it up and push your toe toward the floor and gently guide your foot into the stocking. Pull on the handles and just pull up the sock up your leg. And I usually adjust it by pulling out a little bit of extra slack just to even out the sock. It's very firm, but that is that's the way to get the stocking on. Voila. And then the reverse process is using the stocking doffer to get the sock off. And you actually, you're using this just like a shoehorn. You take it and stick it on the back side of your sock and gently push down the back of your leg so the smooth side of the doffer is gliding on your leg. Being careful when you get to the heel, not to catch your heel. And just guiding it around your heel until you can feel the sock begin to slip off. And you may have to push a little bit with your arm until the sock comes off completely. So I'm at week 10, and I can get down a little bit further than I did certainly at week 1 or 2. But yeah, it's a daunting process when you're just fresh out of surgery. So hopefully that is something that can be of use to people who are doing this piece of the surgery process.